Hello, back again with another episode of Real Health Talk with Dr. Coring. For those who do not know me, my name is Dr. Coring. I am a board certified internal medicine physician and is in training to become a hematologist and oncologist. And it's my absolute passion as well as pleasure to educate common folks such as yourself on how to be well, how to prevent disease. Typically, I like to do this to basically reduce the health literacy disparity. Yes, there is a health literacy disparity, and I like to educate my patients in order to reduce that gap by making patients more educated and aware of common issues. And today, what I would like to discuss is heart health. Cardiovascular disease is the leading cause of death right now in the westernized civilization, especially in the United States of America. And preventing cardiovascular disease is very important. And doing so, I would like to talk about aspirin. And there may be talks, or you may have heard talks about taking low dose aspirin, meaning 75 to 100 milligrams of aspirin daily. And today I would like to discuss who should be taking or who do we recommend taking this low dose aspirin every day. So the question is low dose aspirin right for you? Let's talk about it. So I would like to start the discussion with a couple of facts. So in 2019, the American College of Cardiology and American Heart Association, they recommended through guidelines in order to primarily prevent cardiovascular disease, they recommended that adults age 40 to 70 years of age who are at high risk of cardiovascular disease and are at low risk of bleeding, they recommend daily low dose aspirin to prevent cardiovascular disease. Primary prevention. And what does that mean? Primary prevention means to prevent a episode or an initial episode of a myocardial infarction and heart attack. And so if you already had a myocardial infarction or a heart attack, then you should be taking daily aspirin for secondary prevention to prevent a second or another myocardial infarction. And so if you're in that category where you already had a myocardial infarction, then it's absolutely recommended, if there's no contraindications, to take daily low dose aspirin. But today I want to talk about preventing a myocardial infarction or a heart attack from happening in the first place. So if you never had one, I want to continue you on that road. I want to continue to allow you to be naive or ignorant or not having to experience a heart attack or myocardial infarction. And what is a myocardial infarction? It's basically when your heart, the blood vessels in your heart become occluded with plaque. And that plaque is causing a lack of blood flow to your heart, which causes your heart to be injured. And sometimes that injury could be fatal and cause a heart attack. And that is a medical emergency. And we want to prevent that because that is a leading cause of death in our country. And the American College of Cardiology and also the American Heart Association is recommending that people who are at high risk for this myocardial infarction to happen, they are recommending that you take aspirin every day to prevent that for primary prevention. But a few years later, actually, in 2022, the United States Preventive Services Task Force, abbreviated USPSTF, came out with a statement saying that people who are age 40 years to 59 years, so this is different. The ACC, or the American College of Cardiology, said age 40 to 70. Now, The USPSTF is now saying age 40 to 59. So if you are in that age group and you are at high risk of cardiovascular disease and low risk of bleeding, then they're recommending you take daily low dose aspirin. So there's a little discrepancy, there's a little difference, and it's the age. All right. And so now in 2022, the U.S. Preventive Services Task Force is saying if you are over 60, you shouldn't take aspirin. All right. Only from 40 to 59 years of age. And that's typically what we go with for primary prevention. All right. So if you're in that age group and you're at high risk of cardiovascular disease, and I'm going to define that. All right. I'm going to spend the remaining time defining what is high risk of being or actually getting a cardiovascular disease, mainly a myocardial infarction. What does that mean, Dr. Corin? How do I know if I'm at high risk of getting a cardiovascular disease or myocardial infarction? Well, I'm glad you asked. So we as physicians, we calculate your risk. We determine your risk and based on a few variables. And basically we determine the risk of you having a heart disease within the next 10 years. And we basically measure that with a percentage. And so if the percentage based on our calculation is greater than 10%, meaning there's greater than a 10% chance, a 10% or greater chance of you actually having cardiovascular disease within the next 10 years, then you should be on aspirin every day, low dose, unless it's contraindicated. And so now I'm going to talk about one, what would make us feel like you're at high risk, greater than 10% or greater, of having cardiovascular disease within the next 10 years, and also what would be considered high risk for bleeding. That's what I want to spend some time on. So basically, what will put you at high risk category of developing a myocardial infarction or heart disease? Ethnicity. So if you're African American, that puts you at high risk. If you have high blood pressure and are being treated for the high blood pressure, that put you at high risk. If you have high cholesterol, hyperlipidemia, I don't know if you ever heard of LDL, but if that LDL level is high, if your triglycerides are high, that put you at high risk. If you have diabetes, type 2 diabetes, even type 1 diabetes, that definitely put you at high risk, especially if you are insulin dependent diabetic, meaning you depend on insulin for your diabetes. That put you at a higher risk of developing heart disease. If you smoke, if you are a smoker, you're smoking every day, that also put you at high risk. And so it's important that if you are fitting these categories that I'm referring to, you should talk to your primary care provider to assess your risk and your eligibility to be on aspirin every day and assess your risk for developing a myocardial infarction to give you the indication to be on aspirin every day to prevent a myocardial infarction. So for primary prevention, remember, if you already had a myocardial infarction, you should be on aspirin already. For secondary prevention, unless it's contraindicated. And now I want to talk about the contraindications. What are the risks? The primary risk for aspirin, the primary thing we worry about before we administer the drug and prescribe the drug is bleeding. Aspirin put you at risk for bleeding, especially if you take it every day. All right. So what are the risk factors? Again, bleeding. If you have a history of bleeding, mainly intestinal bleeding, we call it GI bleeding. So if you have a history of intestinal bleeding, if you ever had ulcers, ulcerations of your stomach, if you ever had a surgery and that, with that surgery within your GI tract, it has caused problems and bleeding. That's a concern. If you had a history of brain bleed, especially a stroke or a brain bleed because of you fell and now you have a hematoma in your brain, that's concerning. All right. So if you're on medication already for keeping your blood thin, like anticoagulation therapy, if you're already taking a blood thinner already, like clopidogrel, Plavix, these types of medications. If you're taking non-steroidal medications like ibuprofen every day, if you're taking steroid therapy every day like prednisone, if you're on these types of therapy, they already put you at risk for getting an ulcer. And then we add another medication that could also put you at risk for getting an ulcer within your GI tract, which is the aspirin. Those things have to be considered and discussed with your primary care provider before taking the aspirin every day. So what I'm trying to say and what I'm trying to encourage is, yeah, you might fit the risk category of developing cardiovascular disease, especially within the next 10 years. However, aspirin still may not be good for you or may not be right for you to take every day because you also may be at risk of developing a bleed, mainly a gastrointestinal bleed. And so those things have to be determined and considered. So before taking aspirin every day to prevent cardiovascular disease, please assess this. Get this assessed with your primary care provider. All right? So in summary, cardiovascular disease is the leading cause of death in our country. There's ways to prevent cardiovascular disease. One of the ways, according to the American College of Cardiology, the American Heart Association, as well as the United States Preventive Services Task Force, recommend that aspirin can be a way to prevent cardiovascular disease. However, it may not be right for you, and or it may be right for you. If you are within the age of 40 to 59 years of age and you are at high risk of developing cardiovascular disease, meaning you're African American, you have hypertension, you have high cholesterol, you have diabetes, you smoke, if you are fitting some of these categories, you may want to talk to your doctor about starting aspirin for primary prevention of cardiovascular disease. However, if you have a bleeding risk or have a history of bleeding, especially stomach and brain bleed, you may also want to talk to your doctor about these events as well to really thoroughly assess your eligibility for daily aspirin. I love you guys. That's my time. Stay well, be well. I want you to do that. That's what I like to do, and that's my passion. Please like and subscribe to the channel so the channel can grow, so I can continue to get the support to give you content to stay well. All right, peace.